I'll be presenting on my case study of vascular depression. Chief complaint: having difficulty concentrating, sleeping, lost 7 pounds over 2 weeks, and a sad mood. This is Miss Drucker, a 76-year-old female with past medical history of hypertension, hyperlipidemia, coronary occlusion, presenting for the first time with psychiatric symptoms of sad mood, diminished interest in activities enjoyed, excessive worries over finances, feelings of insecurity during interacting with others, difficulty concentrating and word finding, social isolation, short-term memory problems, weight loss of 7 pounds over the past 2 months, insomnia with interrupted sleep. Her past medical history is hypertension, hyperlipidemia, coronary occlusion. Past surgical history: stent for coronary occlusion. Social and substance abuse history: smoked half a pack of cigarettes a day for 30 years. Plays weekly card game at senior citizen center. Her medications are hydrochlorothiazide, homostatin, atorvastatin, low-dose aspirin. Her physical examination reviewed: alert-oriented ×4. She appeared drained of energy and taking long time to respond to questions. Her neurological examination: intact and remarkable. She had a depressed mood and anxious, preoccupied with her finances. Her affect was sad. Recall: forgetful, able to recall 2 out of 4 objects in 3 minutes, unable to cluster similar items. Thought process: disorganized. In 1 minute, she will think of 14 items in a supermarket. Concentration: difficult to produce a list of vegetables alternating with items of clothing. She produced 12 correct responses and 4 errors. Psychiatric evaluation: she scored 22 out of 24 on her mini mental state examination. Stroop test took over 1 minute to identify a color. Clock drawing: spaced hours unequally, though drawing a clock placed hands correctly. These results reviewed cognitive impairment. Executive dysfunction also was noted given the history of hypertension, which exposes her for subcortical ischemia. Imaging studies: CD head reviewed pronounced periventricular and subcortical white matter hyperintensicities. There is a strong evidence that WMH are clinically important markers associated with hypertension, smoking, vascular dementia, and vascular depression. Considering the psychotic symptoms of Ms. Drucker, vascular depression will be my diagnosis. I considered three differential diagnoses: major depressive disorder, dementia due to Alzheimer's, vascular dementia. Her correct diagnosis is vascular depression. Rationale for diagnosis. She has risk factors of advanced age, past medical history of hypertension, hyperlipidemia, had smoked for 30 years, and coronary occlusion. She lost interest in weekly bingo card plays, weight loss of 7 pounds, executive function problems. The confirmatory diagnostic CT had findings of pronounced periventricular and subcortical white matter hyperintensities are suggestive of vascular depression in this population. Evidence. Cognitive slowed speed of information processing and impairments in concentration and attention, as evidenced by dropping out of the bingo play because of having difficulties to concentrate. Her history of smoking might have contributed to restrictive blood flow, leading to cell ischemia because of stiffened blood vessels from coronary occlusion. Symptoms of low energy and sad mood changes are suggestive of vascular depression. Treatment. Ms. Drucker will be counseled to consider lifestyle modification behaviors of increased physical activities, which has proven to reduce inflammation, cardiovascular risk factors, and improve endothelial homeostasis damage in vascular depression. She will be walking at least 3 times per week and staying hydrated. Treatment continues. In addition to increased physical activities, I'll initiate low-dose Zoloft 25 milligram by mouth every morning. Add melatonin 6 milligram at bedtime. She will also follow up in 2 weeks with a plan to titrate Zoloft dose to 25 milligram if well tolerated. Patient education will be provided. The purpose of the medication is for treating her depression and should be taken daily by mouth, with or without food at the same time. Side effects will be discussed, which include drowsiness, weakness, dizziness, headache, and if she experiences these, she should call the office. Also, adverse side effects like rash, hives, difficulty breathing, she should stop the medication and call 911. Thank you for listening to my presentation.